Good morning, everyone. There's a flood of people coming in the room, so please take your seats. We'll go ahead and get started. I'm Julie Gerberding. I'm the President and CEO of the Foundation for NIH, and I'm really, really delighted and honored to welcome you to this wonderful commemoration, but also a wise crowd of extraordinary people who've been working together for a long time. It was a bit daunting to think about how to introduce this conversation, so I decided to consult with one of my mentors and colleagues, Professor ChatGPT. And ChatGPT provided me with a few stanzas of haiku in the spirit of diversity and inclusion, so I'll just read you a couple of them. Cells converge with care. Health and science intertwine, wellness blooms in sync. Lab coats intertwine, knowledge blooms in shared embrace, science sparks alliance. I thought that was perfect for this discussion, science sparking alliance. And truly, the AMPS have been an extraordinary alliance through the years. It was kind of by the numbers, which I think you probably saw as you were milling in here. 10 projects in 34 industry partners, 37 nonprofit partners, a growing number of patient organizations, 1,900 publications so far. 640 researchers have been supported through AMP-funded projects, 5 data portals that are available to the public, 637 data sets across 4 disease areas, leading to 58 new therapeutic targets and novel pathways that have been identified. So in a decade, an extraordinary amount of output, and part of what our challenge will be as we go forward is how to make sure that output gets converted into impact that really does make a difference for patients and the availability to do what brings us all here together today. So science breeds alliance, and when I am asked to explain what FNIH does, one of my favorite things is to talk about the AMPS, because it really is so extraordinary, so unprecedented to bring the people together from 16 NIH institutes so far with the best and brightest counterpart scientists in industry, academia, patient organizations, and foundations to come together in a pre-competitive environment and really tackle some of the most important challenges that we face in medicine. It's an extraordinary opportunity with, I think, a very high probability of success and many shots on goal. And we've really, I think, begun to see the reasons why these AMPs continue to grow, and we obviously have more in the pipeline now. So I consider your work to be a national treasure. I believe that science is on our side and that we can do more together as we go forward. But we do have some challenges, and without going into them in detail, clearly we're concerned about the status of NIH funding and the foreseeable future. Even with modest increase in budgets, the cost of science, the bird pie is going up, and this means that resources are rate limiting in many cases. We also recognize across the broad spectrum of the biotechnology industry that R&D productivity is not as good as we would like it to be, and there are fewer fungible resources there under the pressure of new pricing constraints and a lot of other challenges for the industry. And I think one of the things that means for us at FNIH, where we have the responsibility to try to generate additional resources to support team science, is that we will be looking for focus and making sure that what we do invest in really matters and really does drive impact, but we'll also be looking for philanthropic support to help augment the work that's been going on primarily through NIH and the life science ecosystem. So much work to do, but I think it's for a good cause, and it's that good cause that binds us together. Science, of course, but really purpose, and our purpose really is to try to find safer, faster cures for patients, but also to really build on the steam engine of the scientific advances that have brought us to this point. So with that brief overview and introduction, I would like to thank a few people. First of all, I'd like to thank Courtney Silverthorne, who leads the AMPS for us, but also has been herding lions to bring you all together for this meeting. I also thank Janelle Lewis and her team, her events team, who've created an extraordinary venue and I think use their best expertise to convene such an amazing group of people. I certainly thank all of the team at FNIH for their leadership of the various projects. It is herding lions to manage an AMP with a little bit of a high horizontal transactional cost, but an extraordinary efficiency and vertical execution. So thanks to the team, but also thanks to our NIH colleagues who really are the most important pillar of success here, and their extraordinary science leadership and their creativity and their wisdom is what helps drive the AMPS forward with all of the partners that are assembled here today. It is really, as I said, it's a national treasure, and we need to continue to grow and expand it. And with that, it is my delight to introduce to you Dr. Larry Tabak, who is currently the Principal Deputy Director of the NIH, has had quite a few titles in the last couple of years, but has a long tradition as a scientist and a scholar of his own merit, and certainly his wisdom and his leadership of the NIH through some really difficult times, absent a confirmed director, through a pandemic, and negotiating an extremely challenging political environment. So Larry is someone we all hold in the highest esteem, and I personally came into FNIH just a year and a half ago or so and got to see Larry in action every Tuesday morning as he led the COVID effort. So Larry, thank you so much for your leadership, and thank you for being here in person to welcome our group. Thank you.
Well, thank you. The combination of artificial intelligence and Julie basically said everything I was going to say this morning. And this is the point where everybody's shoulders sort of sink because you realize that the NIH director isn't going to be here, and it's me instead. So I apologize for that. But I do bring you greetings from the NIH director, Dr. Monica Bertagnolli, who wanted to be here, but it just didn't work, and so I'm very privileged to stand in for her. As you've heard, the mission of these extraordinary programs has been to deconvolute mechanisms of disease and ultimately to figure out new targets for treatment and to develop platforms and processes to accelerate new approaches for our patients. That's one of the things that is so different about these programs is the patient groups who have been integrated and engaged with us from the very beginning. It was delightful to see actually two long-standing patient advocates here this morning who I hadn't seen in person in so long, and it was wonderful to catch up with them, if only briefly. All the projects have a somewhat different approach, but their goals are common, to increase the number of diagnostics and therapies and reduce the time and the cost to deliver them. NIH's investment in the AMP program now is over $500 million. NIH investments have more than doubled since the launch of the program way back when it was 3 diseases in 2014. As mentioned by Julie, 14 institutes and centers, the Office of Research on Women's Health, and the BRAIN Initiative have all certainly participated and contributed. And I think the strength of the program, as you look for the lessons learned, is in the shared governance and resources between the NIH, the private sector, the focus on the pre-competitive space, including the patients in a real and substantive way. All of this is leading to an increase in our understanding of the biological basis of disease. You know, when you speak to members of Congress and you speak to their staff, some of them just they get a little agitated when you try and describe something as bold as this, and they look at you and they go, well, why can't you just come up with the pill? And not quite understanding what goes behind the pill that's in your medicine cabinet. And I think the AMP programs really have done so much to create the new tools that we need and the data portals that we have. And now we're trying to get those data portals to sing with one another and in harmony. And that is also quite wonderful. So, Courtney, the first ever gathering, turning away people. Wow. We could have sold extra tickets on eBay. It's a fundraising opportunity for the future. Really, congratulations to the entire group. Courtney especially, of course, Julie. David, I see here today. Good to see you again, David. From the NIH leadership, congratulations. We are looking very much forward to the readout of this extraordinary meeting. And I hope plans have already begun for the 20th anniversary. No doubt by then we'll be celebrating amazing cures that will be improving patients' lives. So thank you all very much.